on the order of a case every million doses. How do you do that? How do you connect the dots? So kudos to this multi-layered approach, this web we have in modern society to catch troubles with these new vaccines. I mean, really, that's awesome. So if any of our residents think they've had something from a vaccine, even if it's not for sure or proven, just report it. Just report it. Not to your local doc necessarily or our health department. We can't handle all those phone calls. But report it federally to VAERS, Vaccine Adverse Event Reporting System. Just do it. Or if you've connected vSafe to your cell phone, do it there. It's really easy to do. And let the feds figure it out. Let the CDC sort through all that noise and figure out what's real. The more we do that, even the safer these vaccines become. It's a great strategy. It's a real opportunity. And I hope it's apparent to people that this is very open. This process is open. You're hearing about it. This isn't clandestine, behind closed doors, secretive, you know. So there's a real silver lining to this. I think we'll be back to these vector vaccines. Understand maybe which subset you might think twice about giving it to, perhaps, will be part of the discussion. But I'll tell you, these rare cases of events with the vaccine are still not of the order of magnitude of the adverse events we see with a natural COVID infection. We've learned that the hard way over the last year. Very respectable, novel strain of the coronavirus. This pandemic has been very real. The footprint is big, it's deep, and it's all over the globe. It's a real thing. So yes, vaccines aren't perfect. These are very effective vaccines. A little bump with a couple of them. Let them work it through. But don't give up on vaccine strategy. I certainly wouldn't as a clinician. We will have a special clinic, as has already been mentioned, with FEMA and the State Department of Health, April 20th, 24th. I think you all will discuss this further. Talk to your pharmacy or go to rshot.in.gov or simply call 211 for your vaccine. Thank you.
Just quickly, some of the reporting that I've seen about the 1 in a million incidents, some folks tried to put that into perspective compared to other pharmaceutical products that, you know, this is much safer than some common things that are available. Any comment on that? Or
I wish I had a great comparison, but you're right, the scale is very small here. All eyes are on it.
Right.
Very press-worthy. Yeah, I wish I'd come with something.
No, and I put you on the spot.
You're right. It's.
I put you on the spot. I heard some things this morning, but I'm not going to repeat them because I don't know if they're scientifically based or not. But
so clinical medicine is full of risk. I mean, it just is. Nothing's perfect. Nothing we administer is 100% safe, including vaccine strategy. It's a risk versus benefit ratio all the time in clinical medicine. Good point.
I think what I did hear also this morning was that State Department of Health is going to have, I believe, a press conference today to talk a little bit more about what they plan on doing. I know we've heard the term pause with the J&J, and we don't know what that means either. So that's obviously...
Yeah, their medical director, Lindsay Weaver, she is a home run. She is really bright. I hope she's at that press conference. I'm sure she will be.
Good. All right. Well, thank you, Dr. Remington.
Yeah.
All right, Teresa, as usual, we let you dive into the numbers a little bit.
Good morning. Well, we're coming out of our spring break, and I'm pretty pleased. The numbers, there's been some raise, but last week's numbers were 108 cases compared to 106 the week before. So we don't want to stop paying attention, but I'm relieved at those numbers. Over the last couple of weeks, I've been paying attention to mask mandate issues to make sure that we weren't seeing a significant problem as those guidance change, and comparing numbers, watching states that had lifted their mask mandates to make sure to see if anything bad was happening someplace else before it gets here. And I'm mostly reassured right now. Michigan's the most impressive. They do have a mask mandate, but they have a lot of cases going on up in Michigan. So that's always concerning because Michigan's not that far away. Overall, I'm pleased, though. We've been looking also locally, at our breakthrough cases. A breakthrough case is if someone becomes ill 2 weeks with COVID, 2 weeks after their final vaccine or more. And we have 2 confirmed breakthrough cases, so that's statistically correct. That's where we should see it. We know vaccines are not perfect, and so having 2 people who went on and developed COVID or tested positive for COVID after being vaccinated is not a shocking number. Another one of the local numbers that we looked into is anecdotally, we had heard that a lot of people were becoming ill with COVID after their first shot. I had heard it as I listened to people register, and so we looked into that to see if that was statistically significant. And what I found was that it ran between 6 and 8% of cases were someone that had the vaccine, and it was too early to call it a vaccine failure or anything. It just happened to be on top of one another. That number didn't alarm me. It seemed to be pretty in line for what I might expect to see. So that's where my numbers are at right now.
All right, very good, thank you. Kurt from Bowen Center, Kurt Carlson, I know, as Dr. Remington alluded to, are doing a lot of the heavy lifting with the testing, public information, hotline, vaccination registration. And Kurt, again, thanks for everything you and Bowen Center are doing. We'll give you the mic to expand a little bit on how things have evolved here.
Okay, yeah, testing is like everywhere down. We're doing a little over 200 a week, so that's staying fairly steady. Monday, Wednesday, and Friday, for whatever reason, are always higher than Tuesday and Thursday. That other thing that we're doing with those same staff, as the mayor had mentioned, for people with language or technology challenges, they can call our hotline. That's 574-347-4256. And right now, about 53% of those calling are Spanish speaker only, and about 74% of the people who call, we actually get registered, which is up from earlier on, about half of the people just looking for information, and now the majority of people want to actually register. And I believe there's going to be some flyers going out to the community, Mayor?
Yeah, we've got a local group that's put together a brochure of vaccine education with the hotline number on it. It's bilingual. There's one side Spanish, the other side is English, and through our fire department and local groups, they're going to get out into the neighborhoods tomorrow and hopefully distribute around 1,500 of those brochures and take them to businesses. And again, just trying to raise the awareness and to cross that language barrier that still seems to be somewhat problematic in getting folks registered. But hopefully this will try and allay some of the uncertainties, questions, hesitancies that people have about the vaccine. And again, I'm very encouraged with that brochure and with the cooperation of our entire community to get that information out. You may remember we did the same thing with testing and early COVID education, and we're just kind of doing 2.0 tomorrow. So yeah, thanks for mentioning it. And I know Gamal out at Bowen Center has been a big part of that outreach as well. I do believe also the chamber is going to be disseminating and distributing those brochures. So tomorrow you'll see some flyers hit the neighborhoods. So, Kurt, there was something I wanted you to talk about. On your hotline, you know, people are calling in. Have you anecdotally identified any common concerns that people have when they call in? Have your people talked at all about maybe things that are on everyone's mind about the vaccine?
Yeah, the flyer that you mentioned, an earlier version was more expansive. There were more commonly asked questions, and so our staff have that so they can give the consistent answers to the questions. And it really, it ranged from, which of the vaccines is safe, asking about timing, asking about location, and some people just very much expressing concerns about it. And I think they were calling for just one more voice of reassurance that they should go ahead. I don't think they were looking for justification to continue to hold off on getting the vaccine. So it's kind of evolved a bit. Again, now it's more, I'm calling to get registered.
Thank you. I also know that, as we've discussed here, we've got the state clinic, we've got our local clinic, we've got the pharmacies. We're also hearing some industries are able to access the vaccines for their employees. As Dr. Remington said before you all got here, with all that's going on, as long as we get it done, we aren't able to get our arms around everything, but there's a lot going on, and as long as we get the vaccine in the arms, that's the most important part. Teresa, any comments on the employers that may have access? I don't know that we're aware of how that works, but any comments on that?
Well, I did clarify recently, because we were talking about Maple Leaf having their own clinic, and the way that they found they were able to hold that clinic was by contracting through a local pharmacy. Theirs is through Myers, and so, but if there are businesses that are interested, they may be worth calling some of the private pharmacies too, to see if they can find something that's more accommodating for their business's needs.
I think that's a great opportunity, and I know the state, is part of their strategy, wants to expand that. I don't know the details personally, but it's nice to hear we had a local example of someone being able to pull that off. It's hard for people on the line to get off work to go get a vaccine. I really get that. We were going to have a Saturday vaccine this weekend. It was with the J&J vaccine. We had 400 doses. Going to be one and done, right? For a special clinic, we just wanted a single dose strategy, so we had to cancel that, unfortunately. It was kind of a quiet, private offering to an at-risk demographic in our community. But if the employers can pull this off, boy, that's a home run. That really is. I hope that can be developed even further.
So Teresa, I think you mentioned that Maple Leaf actually has a staff or whatever that could really do this well. And
Actually,
all
they
manufacturers
said
don't.
they're using the pharmacy. The pharmacy
Okay,
is taking care of it. They're
Oh,
not.
really?
So yeah, no, I was
That
not
would make it
informed
simple.
earlier, but yeah, it was much simpler, and sounds like even some of the smaller businesses where I was like, I'm not sure how anyone could help you pull that off. Sounds like pharmacies may be able to help part of those.
So it's not the Maple Leaf staff doing it, it's the pharmacy staff. Interesting. Okay.
And all of this sounds a little bit unsettled as far as where all these vaccines are coming and going. And again, our discussions, we know that the state's done a marvelous job with the doses they've been allocated, getting them out to the local communities. But our understanding, and again, jump in here, is that the feds have provided these doses, kind of gone around the state, provided those doses to the large pharmacy chains. And they also, if I remember correctly, in the early days of vaccination at the nursing homes,
Yes.
also contracted with the pharmacies.
CVS or Walgreens. Right?
And that didn't really go through the health
No,
department, so there were things going on
Sure.
that the health department didn't, and go ahead, jump in.
No, that's true. That was totally independent of us, which is fine. Again, the more the merrier here. Let's just get this done, right?
As long as we get it done. Yeah. Well, so that's, and that still tends to be evolving. So we'll just see how that plays. And told Kurt we've been pivoting and dodging bullets through this whole thing. And the J&J was a little bit of a curveball yesterday, but I think that'll get resolved. And I'll take Dr. Remington and Teresa's word for it that potentially those vaccines may be back at some point. But in the meantime, we've got lots of really good, solid Pfizer and or Moderna, and then the Pfizer at the state clinic that are still being offered. There's appointments available still this week, and with the clinic next week being still very available. again, 211 or rshot.com or 347-4256, and please get registered. And I do also want to bring something up. I know Dr. Remington mentioned roughly 31% of the age 30 and above population.
So, I mean, as far as immunized?
Immunizations, and then kind of adding that into those that may have,
Yeah,
in other words, where do we stand with kind of an unofficial
Right.
herd immunity?
So Teresa and I have had this, actually, Teresa has really advanced this conversation, but let me start and then Teresa can finish. I just pulled this from the state's dashboard this morning. Around 30% have had at least one dose. 30% of our county population, 16 and older, have had at least one dose of a vaccine received somewhere. And we think on top of that, there's certainly naturally occurring immunity. We've had, I'll let you finish.
We've had, we had 9,000 cases, so that's a little more than 11% of our population. I didn't do that math by a calculator, just in my head. So, and then we know that this is a disease that many asymptomatic cases exist. And so I feel very comfortable in saying, I'm sure we've had at least twice that. And so knowing that some of those are duplicate from the vaccine people, but also there's a lot of those are not duplicated with the vaccine, that starts taking us up there. 45% or so of our population may already have immunity through vaccination or natural means. And so that's one of the reasons why I think it's, we're not seeing our curve after the break go crazy. I don't want to be too confident in it, but at the same time, I'm reassured.
Yeah.
And that really underscores, again, the significance of the vaccination. I can't stress that enough, obviously, and we're all up here for the
It gets us where
same
we want to
reason.
be quicker, right? I mean, the natural history of pandemics is they eventually wimp out on their own. 2.5 years, I guess, a century ago with that big one. I don't want to do this for 2.5 years.
No.
Vaccines, effective vaccines, get us there so much quicker. And it is honestly such an opportunity for modern society to have these vaccines just a year into this. It's and it's demonstrated it does bend the curve. UK had a great experience. Israel's had a great experience. As you get those immunization rates really up in those populations, their cases really dropped off compared to peer groups. So it's observational. Can't perfectly say cause and effect, but wow, I mean, it's such whopping, eye-opening difference with robust immunization rates. Very effective vaccines.
All right, I think we'll open it up for questions. Nick, WRSW.
Dr. Remington, the first question I have for you is regarding the J&J vaccine. I've seen concerns out there of people that have gotten it. Is it, if they don't develop any of the side effects that we've heard of, are they all right? Are they going to be okay? Do they have to get, quote unquote, revaccinated, or should they just not worry if they don't get any of these side effects?
So the absence of side effects with any of these vaccines does not mean it did not take. That's a lot of negatives in that sentence, right? We have no evidence to suggest that you were not effectively immunized, even though you had no symptoms. Well over half the patients at least get something that they feel from these vaccines. The reactogenic side effects are prominent and much discussed. Skin reactions are the most prominent. Generalized complaints, fatigue, headache of the non-life-threatening, not eye-opening variety, fever, body aches, those are pretty common. People with these horrific headaches with neurologic focal complaints on the order of 1 per million is a different scenario, right? I would hope if anybody thought they were experiencing something really out of the box for them, that they seek care. If someone has just generalized smoldering complaints, whether it be post-COVID natural infection or perhaps even weeks lingering from a vaccine, just touch base with your primary care continuity medical provider if you have the luxury of having such a thing. Let them hear your story. I think that's the best way to triage these. Using the safety net around vaccine adverse event reporting. I mentioned VAERS, kind of a mouthful of an acronym, but it works. It's a little cumbersome, I think, for lay people. You might like VSafe better. I just was prompted by VSafe yesterday on my cell phone, months after my completed Pfizer vaccination, to ask me how I was doing. 3 simple questions. It took me 30 seconds to complete their survey and send it back to them. So they're following me up. That's good. VSafe, I love it. That was, I think, a new thing for this vaccination campaign. I think it's really a slick program.
Okay.
So, you know, just again, back as a clinician, the nuances and hard to sort out peculiarities of delivering human health care in primary care. There are a lot of vague things that impact any, you know, population of patients. And here we are putting lots of doses of something into people's arms. We've had a novel infection come our way for a year. How much is it of those, you know, kind of poorly described symptoms are attributable to any one of those things can be hard to sort out. And we may not have perfect answers, but talk to somebody about it if you have concerns. And I honestly think primary care is a great place to start with this, if they're not immediate and horrific kind of complaints. Yeah. Did I answer your question?
Time slot, are they getting pushed to something else where they can get the Pfizer or the Moderna?
Well, there's been a lot of work in the last 24 hours behind the scenes to scramble and try to connect with those people. Kirk Carlson.
Vaccine, and then what do you know about Moderna trying to kind of add like a flu?
Yeah.
Can you talk about maybe what you know?
Yeah, I think we'll see those strategies emerge, Amanda. I don't know all how this exactly will shake out. I think there will be booster doses coming. Combined products would simplify the process for those who would also desire seasonal influenza immunization. I'm a fan of those strategies. And it wouldn't surprise me at all that we need a booster with this. I don't know the details. This current strategy seems to have legs of several months of good efficacy, as the natural infection seems to too, honestly. So we just don't, again, this is all new, so we don't perfectly know these longitudinal issues. Wish we did. Great questions to all of us are wondering.
Yeah, I had a very similar question. In fact, this morning, I think they talked about either Moderna or Pfizer has looked back and they've shown their 6-month success rate has been over 90%, which is obviously good, but that doesn't imply that 6 months is all it's going to last. It's just that's all the data we have at this point. But I, like you, really are interested in knowing maybe we will need a booster at a year. It's great. I hadn't heard about the flu shot combination, so good questions.
Yeah.
Dan Spalding from Incree.
Several questions. Hello. Just a few quick questions. How many doses will be available for the 5-day clinic?
I think it was 400 a day. I think they wanted to do 2,000 over a 5-day period.
Okay. And it's your hope to get it booked up as much as possible ahead of time?
I'd like all the slots to
Would
be
be
booked
worried
up. All the
if-
clinics, yeah, exactly.
Will there be a follow-up clinic for the second dose that will be similar to what we'll see next
Yeah,
week?
I believe those dates are May 10th through the 15th, and it'll be at the same location, but that will just be for second doses, at least at this point.
Okay. And obviously the flyers that will be distributed this week, that's an attempt to raise awareness ahead of next week's clinic.
Yes.
Are you starting to worry that even as supply improves, demand will fall?
I don't worry. I I just, we have to make it available, and if the supply's there, we're just hoping that we follow through. That's my optimistic answer.
I think your point's well taken, and this community has had great discussions with leaders already in that regard. I know there's some vaccine promotional media being developed locally. Again, I think we've achieved a lot by robustly immunizing those who statistically have been shown over the last year to be at greatest risk. And I think the state did it wonderfully, as I've mentioned before, by starting with not only first responders, but pretty quickly getting to those 80 and older. Get those done, then whatever it was, 70 and older, and as we worked our way down the age demographics. So as we get into younger people, I think I would expect, just being a clinician, that we probably won't have as robust statistical take on the vaccine. That wouldn't surprise me. But we'll still be immunizing plenty. And I think as people see stories of surges and the occasional hospital system in some metropolitan area that fills up once again, we'll see bumps of vaccine interest as once again the rawness clinically of what can occur starts to hit people's attention again. We have short attention spans, as you know, so the more this gets in the rearview mirror, the more it will be forgotten. But I think we've really captured the moment pretty strongly, and we will have robust venues of vaccine for at least another 6 weeks here. And boy, people should take advantage of that.
Also, on a side note, a month ago, I told you that I got my first dose. I got my second dose today. So
Good.
life is good. And
Life is good.
It's impressive how smooth the process
Okay,
works.
good.
For all the heck that government catches, this is
Yeah.
pretty impressive.
I mean, really, both administrations should be applauded. To have developed a vaccine as quickly as they did, and to get the thing in gear, and then to work on fine-tuning, getting it to scale here with the current administration. I mean, really, the applause should go all the way around. We are very fortunate to have this opportunity.
And Dan, I hear that all the time. Everyone that goes out is so impressed with how the health department and K-21 Pavilion have created just almost a flawless system. So that, again, first of all, the thank you to those that, as Dr. Remington mentioned, there's lots of community volunteers. The health department's been working overtime and very strenuously trying to get all their other work done as well. I know from my seat, I just so much have relied on the health department through this whole thing, and the vaccination clinic has again, this is the final push. And we are so fortunate, I think, with our state leadership, I think our governor, the health department, and now locally, county, what they've done with our vaccination clinic. I've been prepared to handle surges in vaccination demand and haven't needed to because they've done such a good job with how they've handled it. Again, obviously, that makes getting these things out so much easier. Again, probably the only hiccup is that, we need to try and accommodate those that have to get their shot after work or on a weekend. And I think we're going to try and meet that need with a full Saturday next week and those through 6 o'clock appointments Tuesday through Saturday. So I think we're kind of filling in the gaps there. I think the pharmacies probably do offer hours, off hours that would accommodate those at work. So again, we always sit up here and talk about how well things are working, and I know it may sound a little bit patting ourselves on the back, but it's not us. It's the work that's being done in this community by everyone from those sewing thousands and thousands of masks to those nurses that are retired and have come out of their homes to get back and help with these clinics, those that are driving folks, to and from doctor's appointments, and healthcare workers working overtime. this is our community coming together, and we do a good job here. All right. Anyone else? Any final thoughts? Kurt, any final thoughts?
Just, if people need, call that hotline, the 347-4256. If anybody has a language problem or a technological problem with getting signed up.
Teresa, final thoughts? All right. Thank you again. Dr. Remington, all set? Okay. All right. We will be back April 28th, 2 weeks from today. And then I think beyond that, we're going to kind of look, and we'll make a decision in 2 weeks whether we're going to continue with these. I think the recent events this week made it really important to get back in front of you all, and we won't not have these. But if there's nothing to talk about other than getting these vaccinations out, we're certainly going to promote that in other ways. But we will have a press conference on the 28th, and we'll take it 2 weeks at a time from that. All right. Thank you very much.
Thank you.